Have you ever wondered how on earth we humans have the capability to diagnose such various diseases within the human body?
How is it possible for us to see such close images that help us detect every little malfunction occurring inside of us?
There are many things we need to take in consideration because little do we know the story behind the medical world. Hello, my name is Mosqueda.
And my name is Alejandro Cruz.
We are high school students participating in a research program representing the Sarver Heart Center. Question of the day. How does imaging help to identify the types of heart failure? But before we begin, we want to provide you guys with some background information about what heart failure is, how it develops, the symptoms, and ways to detect it.
Heart failure, also known as chronic or acute heart failure, is when the heart is unable to pump sufficiently to maintain blood flow to meet the body's needs. Common causes of heart failure include coronary artery disease, which causes myocardial infarction, high blood pressure, atrial fibrillation, and valvular heart disease. Symptoms such as shortness of breath, excessive tiredness, and leg swelling all occur as a result of heart failure. This leads to our main topic of the day, echo, short for echocardiography.
What are echoes? Echocardiography, also called an echo test or heart ultrasound, is a test that takes moving pictures of the heart with ultrasound waves. It is a non-invasive procedure done by trained sonographers. You'll lie on a bed and the sonographer will put water-based lubricating gel on a probe and move it over your chest area. Ultra-high frequency waves will show images of your heart and valves. Every movement your heart makes can be seen on a video screen or a videotape, or photographs can be made of the pictures for further investigation to identify which type of heart failure the animal or patient has.
In this particular process, the tools you will need will include a cardiac ultrasound machine with computer and software to interpret the imaging, a probe with appropriate frequency for the size of the patient, gurney or bed, water-based lubricating ultrasound gel, and of course, a patient. What can the test show?
The test can demonstrate the following: the dilatation of the parts of the heart, the function of ventricles and valves, if the heart's healthy or if there's damage, the size and shape of the heart, and how well your heart's working overall.
A heart can look normal on an image, but it can still have heart failure. So a doctor must clinically diagnose a patient in order to find out if they have heart failure or not. How do you read echoes? Reading echoes is a serious and complex process with a lot of personal responsibility in patients. Echo interpretation shows what's going on inside the heart and identifies various standard views of echocardiographic images. The images of the heart generally show 4 chambers, and every single angle is important because it provides you with enough information on how the heart's performance is.
Here's an example of a recent echocardiography studied in Dr. Goldsman's laboratory. This image demonstrates a short axis left ventricle view of a healthy heart, as opposed to an unhealthy heart where the motion is not uniform around the heart, and the section of the wall is damaged and thinner than what a healthy heart will look like.
Here are some examples of recent echocardiographies worked in Dr. Abadoff's clinical research. The first image shows a 4-chamber heart that is at its resting state. The next image shows the same heart after adding a stimulus that dilates the heart after 2 minutes. The final image is the recovery state, where after 5 minutes the heart is getting ready to go back to its normal state.
Echocardiography has become one of the most useful tools in the studies of cardiology. It has collaborated with research studies with the detection of various malfunctions within the heart due to heart failure. There are many things you need to think about when it comes to performing such an informative task such as echocardiographies.
Here is an ending question that remains unanswered. How accurate are these images?
Cut. The Sarver Heart Center. You
high school. High school.
I said high school. Heart failure within the heart. No! I missed in the heart. No! I missed.
Stop your nonsense.
What was that?
What was that? Go ahead.